two programs, Work Comp Coach and the Hiring Alarm. And you'll get touched on a couple of those as we go along. I'm a certified insurance counselor, a certified work comp advisor, and a professional work comp advisor. Maintain those designations. So hidden cost, we're going to touch on that. We're going to touch on a couple of areas here. We're going to talk about impact on people and impact on business and those hidden costs. But the one thing that I hope you'll understand is workers' compensation is simply the financing tool that businesses choose and use to pay their workplace injuries. Workers' comp is statutory, so you're required to have it by state, but the type of plan that you choose is the financing tool. The most common plan we see is a guaranteed cost plan. The guaranteed cost is most likely what's on your work comp policy. There's a payroll, there's a rate, and then there's a premium, and that's what your cost is, or at least perceived to be at the time. There are plans that are high deductibles, retrospective rating plans, captives and stuff when your business gets much larger. What do we get when we buy work comp insurance? We're getting a benefit, right? And there's two types of benefits. We break it down into medical benefits and indemnity benefits. And those medical benefits obviously are your doctor bills, your pharmacy costs, rehabilitation, transportation to and from the doctors in some cases, death benefits. Indemnity is really focused on loss of income, as well as a permanency rating. You see those at the end of a claim when an injured worker gets kind of a lump sum check. Typically see that the injured worker is getting compensated for X number of weeks at a certain percentage of disability, and that's an indemnity payment. So that's really comprised of what the work comp benefits are. When people think of what the cost of work comp is, it's that perceived cost, it's the premium, right? And we see that either on an insurance proposal from an agent, or you see that on your policy. Looks very similar to something like this. You'll see the state, you'll see the classification for what your employees are doing, a payroll, a rate, and then the total premium. And that's most often when businesses talk to other businesses, or you talk to an agent or somebody, you say, what's your work comp cost? This is the number that you're using. In many cases, this is the smallest portion of your total cost of workers' comp. And as we go through today, this will start to be highlighted and understand some of those hidden costs that really can get quite substantial. Have you ever hired a person and in the first 6 months of employment, that person was injured and you later discovered they filed a similar claim with prior employees? Have you ever had an injured worker take longer to heal than you think it should have taken? Have you ever felt you had no control over a workplace injury? Well, as you're hearing these questions and you're seeing them on your screen, you're probably answering yes to one or all of them. Folks, you're not alone. This is very, very common in the insurance industry. And unfortunately, businesses suffer as a result of these on a day-to-day basis. You know, I always ask employers, what type of employee class, type of business, type of employee do we spend the absolute most amount of money, the most specialized care to heal the fastest and return to work? How about a professional athlete? Think about it. We're in the middle of football season, whether you're a Redskins fan, Ravens fan, or some other fan. If one of those players gets hurt, are they sitting on the couch for a month, 6 weeks, and then go back to work 100% full duty and play in the game their very first day back? That happens all too often in workers' comp. Person gets injured, they're out, they never seem to come back to work, and then all of a sudden they're 100%. When we see that professional athlete, we see them wearing that little red jersey, riding that bike on the sidelines, or doing some jogging and some training and some stretching. That's modified duty. We're spending the most amount of money putting these folks in the best medical care so we can get them back performing at the highest level as soon as possible. That is really what we try to work with clients to build that model for them so that we're driving improved outcomes going forward. If you are experiencing chest pains, would you go see an orthopedic surgeon? The obvious answer to that is no. What's that got to do with work comp? Why do we allow injured workers or somebody that has no medical expertise to control what doctor is seeing our injured workers? Who decides where they go? Is that injured worker going to their primary care physician that's just a generalist? How often are they going to the emergency room? Those emergency room doctors and those general family practitioners spend a very, very small amount of their time studying occupational disability and disease during their medical training. A few years ago, I was called into a very, very large medical center, 5,000 employees, large regional hospital, and they were having some significant challenges in their workers' comp. They're a fully self-insured program and spent more than $1 million at one time to get caught up on the expenses related to those claims. When I met with the CEO, the CFO, and the director of HR, we met in the employee health clinic. Again, major hospital system, multiple locations. When I got to the employee health clinic, the doctor that was in charge was an 80-year-old semi-retired doctor. I asked him if he was practicing evidence-based medical treatment guidelines when injured workers came to him. Of course, the doctor said that he had been practicing medicine for more than 50 years and he didn't need a new fancy book to tell him how to do it. When I sat down with the director of HR, one of the first questions I asked was, how confident are you that your injured workers are getting the right medical treatment when injured? Well, as you can imagine, the director of HR of a large hospital system was pretty offended because she perceived that I was challenging whether or not her doctors were competent. I assured her that that was not the case and that I would re-ask the question in a different way. And in fact, I asked the exact same question. And I then went to the, if you were having chest pains, would you see an orthopedist? That's when the CEO chimed in and said, can you explain yourself? Well, this particular medical facility was associated with Johns Hopkins Hospital, which has one of the best occupational doctor training programs in the United States. Yet they weren't using that. They were using an 80-year-old semi-retired doctor. And when he wasn't there, which was only 4 hours a day, several days a week, those injured workers were going to the emergency room. That's a flawed model. It's not a model that's the fault of you, the business owner out there. It's a flawed model that's just been created within the work comp insurance industry system. And unfortunately, we suffer from the negative impacts of that. NCCI, which stands for the National Council on Compensation Insurance, they're the work comp similar to what IRS is to the tax code, right? They make the rules. So the NCCI makes the rules, and currently 39 states have adopted those rules. The other states either have their own state rating bureau or their own state funds in the case of monopolistic states. So let's take a look just what's happened in the work comp world since 2004 to 2018. Claim frequencies in the state of Maryland are down cumulative 25.6%. We are having 25% fewer claims today than we were having in the beginning, 2004. Medical claim severity, the cost of medical claims, 17.3% increase during that same period. Indemnity claim severity, which typically refers to the time a person's out of work, is a 36.8%. So the data shows that fewer people are getting hurt, but those that are getting hurt cost more and take longer to heal. The obvious question today is, are our claims different than they've been over the past? No, they're not. We still have soft tissue back injuries. We still have lifting injuries. We still have cuts, scrapes, bruises, bumps. We don't have a newfangled work comp type of an injury that's driving this. What we have and what's driving it is the processes that are in place. Really going to see the wrong doctors. Doesn't mean the doctor's a bad doctor, not competent or capable. It just means they're the wrong doctor. MedMetrics did a study of California, Florida, and Texas, the three largest work comp states in the US, and found that 6.5% of the doctors in those three states were driving 73% of the medical cost of all work comp claims in those three states. Think about that for a second. 6.5% of the doctors are responsible for 73% of the cost. 2017 Best Doctors Survey comes right from the book, talks about mismanagement and misdiagnosis of workplace injuries. This is specific to medical specialties, right? So not your frontline doctor, it's your follow-up doctor, your orthopedics, your neuros, those types. When the specialty was neurology, 47% of the time, there was a change in the diagnosis of the injured worker, and 80% of the time, there was a change in the treatment. For pain management, 45% of the time, there was a change in the diagnosis, and 75% of the time, change in the treatment. Orthopedic surgeon, 33% of the time, there was a change in the diagnosis, and 71% of the time, a change in the treatment. One of the most important areas and one of the biggest problems in workers' comp is getting our injured workers to the right doctor and getting the right treatment prescribed. We have dramatic problems in our industry right now, specifically tied to Oxycontin, codeine, and other very, very harsh narcotics that are being prescribed. In my career, I have seen injured workers who are completely fine, healthy, who get a soft tissue, back injury, shoulder injury, some type of soft tissue injury, who end up getting hooked on narcotics, severely hooked on narcotics, up to including an overdose and death. It's kind of scary when you think that a minor injury is killing people, but it happens today in our work comp. What's the impact on the business? And what's the impact on the family of that injured worker? What's driving this? Some of it is the system itself and the fee structure that the work comp industry puts in place. Oftentimes, doctors are allowed to bill their billing rate, yet it's negotiated fee schedule. For example, in the state of Maryland, Maryland's a medical fee schedule state. So for a particular treatment protocol, the state mandates from a work comp standpoint, you'll get paid X dollars. Right? And when you look at those numbers, they're below the Medicare rate. So doctors can't make money practicing this. So what happens? It drives utilization. Instead of seeing a patient twice, a doctor sees a patient 6, 8 times. Instead of prescribing 4 therapy sessions or 4 rehabilitation sessions, we see 12, 14, 16, and beyond. This starts to develop psychosomatic situations with injured workers. If you're sitting at home and the doctor tells you you can't work, and you're out of work for 4 weeks, 6 weeks, 8 weeks, and every week you're seeing 2 or 3 times a week, you start to build a case in your own head that, wow, there really must be something wrong for me. Or is it simply the doctor chasing the dollar? And in a lot of cases, the system creates that. Unfortunately, we're hurting our employees doing that, and we're causing dramatic financial impact to the businesses. Let's talk about a couple claim scenarios here. Some of these may be similar in your business. The first one, a person was doing some light carpentry work at a residence. They were not wearing a hard hat. The crowbar was in a rafter above their head. It slipped and fell, struck the person. The person ended up going to the emergency room and getting 4 stitches. The nurse practitioner that put the stitches in asked the injured worker, was this work related? Because she had heard that person say earlier in the visit that he had been doing some work that day and the crowbar fell. Well, obviously that person answered, yep, it happened at work. And the nurse practitioner asked that person, how much time off of work do you need? It wasn't the medical professional indicating to them how much time off they should have as a result of the injury. It asked that person how much time off they felt they needed. That person said, how much can I have? How long will the stitches be? 10 to 14 days. Then I'll take 14 days. I'm able to articulate this, folks, because I was the person that this happened to. I was doing a project at my house. It was not working for anybody, it was for me. But when that nurse practitioner asked if it was work related, And my background, I took the opportunity to see if I could manipulate the process. I was stunned at how easy it was. I walked out with 4 stitches and a doctor's note that said I could not do any duties completely off work for 14 days because I had 4 simple stitches in my hand. Totally amazing. Happens every day, and very likely that your business has been a victim of this in the past. I have another client, it's an insured, it's a school, had an injured worker slip and fall on the ice as they were walking into one of the buildings. This particular employee was up in age and not in the best physical condition. The knee injury resulted in the requirement to have arthroscopic surgery. This particular account has a very robust and built-in secondary prevention program that we've helped develop. And that injured worker received flowers and notes from her coworkers wishing her a speedy recovery and missing her at work and couldn't wait till she got back. That had such a positive impact on that injured worker. She reached out to the company, came back to work in a modified duty capacity. She sat at the receptionist desk for the school and continued working. Had a fantastic outcome for that company. I have a trucking client. Trucking client was hiring new drivers. Driver comes up, applies for a job. After having implemented a hiring program, one of the steps of that hiring program included work comp background check. As the employee came in to start their orientation for the new job, they had been given a conditional offer of employment for. It was discussed with them that they had, that the employer had discovered that that injured worker had multiple prior injuries to a knee, and that they were going to need to have a medical determination as to whether or not that employee could perform the job duties. The employee at that time notified the employer to be that in fact they were simply there to let them know that they had another job that was paying them $1 more an hour. So this was a scenario where a prevention strategy was put in place that helped that business avoid hiring what was very likely a future work comp claim. A utility contractor that puts in fiber optics for Fios, Verizon, these type of Comcast companies, etc., had a worker get injured. That worker was a trench equipment operator. Now that sounds pretty complex and a lot of details. And in fact, that's what the doctor was saying. That person had been hurt on the job, had gone to a doctor. The injured worker had indicated to the doctor that they were in fact a quote unquote heavy equipment operator. And as a result of that, the doctor put them off on a full no work, not able to perform any duties. Engaging with that client, we were able to take a video and provide a job description with the essential function of the job and demonstrate that in fact, that heavy piece of equipment was remotely operated using a small, almost computer-like device that sat on 2 shoulder straps and had 2 joysticks that the employee stood next to as it did the trench and it walked alongside of it. So in fact, it was very, very light duty involved, no heavy lifting or anything. Once the doctor was able to get that information, the doctor immediately changed the work restrictions and put that employee back to work on a full duty release. So those are some pretty interesting scenarios that have happened real time, real world that we'll kind of talk about again, how do we get involved and how do we help put these prevention strategies and stuff in place. Let's talk about indirect claim costs, and then we're going to jump into some prevention strategies. So we talked about earlier that cost, right? When you think of your work comp costs, naturally you think of the premium. Here are some things that we need to add in that really start to diminish that cost in the big picture. Medical care, time to and from waiting at a medical facility. In the Baltimore, Washington metropolitan area, the average emergency room visit exceeds 6 hours. What's your hourly rate that you pay that employee and put your burden on top of Did the supervisor go to the medical facility with that employee? Put that guy's time, that gal's time, and their burden on top of that. What impact did it have at your corporate offices? Was there administrative time involved? Was there a person at the office that had to call the agent, that had to report a claim, that had to do an incident report? Was there an incident accident investigation? Who was involved? Do you have a safety director that got involved? When you start to put these pieces of the puzzle together and you start to allocate the time and the labor cost and the burden associated with that, you start to really, really add up some numbers. What impact did it have on the job? Was there downtime? I can remember a job site in downtown Annapolis, a very prominent, the Annapolis Town Center. They had a couple of pretty significant incidents. There were 2 fatalities at that job site. There were other pretty significant incidents. When those incidents happened, they were always on the news. They were always on the front page of the local newspaper. The entire job site, every contractor involved was shut down. Maryland Occupational Safety and Health was out there. So if you're a contractor and you happen to be on a construction site where an incident or accident occurs that involves you, how many other people do you have on that job site? How long are they down? That job stopped for 4 hours, you've got 10 people, that starts to add up the time. Then you start to think about what impact it has on others. When a claim happens and that claim takes time, we have follow-up. Who's following up? That employee's going to the doctors. Is the supervisor involved? Are we making telephone calls to them? Is the office manager, HR director in your company following up with them? Are there conversations with the adjuster, conversations with the agent? All of this time is diverted from your productivity. And as a result of that, it needs to get factored into what your total cost is. Was your equipment damaged? Did you have to repair or replace anything? Was that covered by insurance or was that self-insured? You have a person injured. Someone's got to fill in for them. Is that overtime? What's that cost? Do you have to hire someone? Do you have to train someone new? You need a replacement employee? Who trains that person? That new person that's covering for that injured person, are they as productive as that other person? Particularly when they're first beginning? These things add up. And once you calculate this, you start to realize that the hidden cost of workplace injuries far exceeds the cost of your actual premium in most cases. And here are some other areas. Fines, OSHA fines, EPA fines, other type of federal and state fines. But some that are catastrophic in nature are those of a lost customer or a lost business opportunity. I think of that downtown Annapolis Town Center project, and that contractor that spent so much time bidding and nurturing that business relationship, only to have a catastrophic claim occur and lose any future opportunities for a relationship that they spent 2 years in development. It's gone, it's out the door. It had too much of a negative impact on that project, and all future work was lost. These indirect costs are hard to quantify, hard time. I've actually developed a cost calculator. You'll have my email at the end of this if anybody wants to talk offline or go over one specifically. We're happy to assist with that. It's very, very dramatic, folks, when you start to take a look at a claim that you might think is a $3,000 or $4,000 claim, when in reality over time that $3,000 or $4,000 is $15,000, $20,000 and beyond. So what can we do to try to put processes in place to improve this and really build a defense and a shield for your business, and ultimately reduce the number, cost, and duration of your workplace injuries? We want healthy, happy employees. Ultimately, we want our employees to go home with the same numbers of fingers and toes that they started with. And there's really 2 prevention strategies, right? We think of primary prevention and we think of secondary prevention. And primary prevention is really focused on what do we do to prevent a claim from happening in the first place. And that's your traditional safety, wearing proper protective equipment. Are we training people how to do their jobs properly? That kind of thing. And look, That's the best medicine, because if we don't have an incident, we don't have to worry about the second part of it, which is the secondary prevention strategy. And we start to talk about some of the things we've already mentioned. What happens when an employee gets hurt? How's a treating facility selected? Are drugs, wrong type of drugs and stuff getting prescribed? Let's talk a couple strategies here. When we talk about secondary prevention, one of the key focus areas is on injury management. So right, if we can do primary prevention, we don't have injuries to manage. But that's not realistic. We know in the real world that, in fact, we do have injuries in the workplace. So once they happen, what are we going to do to manage them to the best outcome? What processes do we have in place prior to the injury occurring so that when it occurs, we are managing it? It starts with the proper hiring procedures. What do you do to prevent hiring that next workplace injury? I always use the scenario, if you live on the street with 10 houses and 9 have a burglar alarm sign and 1 doesn't, what house is getting broken into? Well, obviously it's the house that doesn't have the burglar alarm sign. So from a business standpoint, where's your hiring alarm? Where's that hiring process that is easily shown to those candidates that are trying to come to work for you, to let them know that you in fact have a process in place so that you don't hire that next workplace injury? As you recall, one of those claim scenarios, that trucking company, in fact, did have that in place. And there's 3 phases to the hiring process. There's the pre-offer, there's the post-offer pre-placement, and then there's actual. And then there's certain things that you can and cannot do during the course of that. In the initial phase, very simply, one critical question that you can ask, and that is, a potential employee, can you perform the essential functions of the job, yes or no? Well, do you have the essential functions of the job in place? Do you have all the details in place so that our employee can make that decision? And then we can go into some further stuff in the future on all the elements of that. But it starts with having a critical employee hiring process that lets those candidates know, I'm a business, I'm not getting taken advantage of. Here's my alarm system. Those job descriptions. Job descriptions are critical, right? So they've got to be functional, right? What are you going to lift? What are you going to pull? How long are you going to stand? Are you going to be in the heat? Are you going to be in the cold? What are those essential functions of the job that you are going to be able to perform, and that can you perform? It's a critical element. You can go so far, depending on the size of your company and how much you want to invest in this. You can actually work with specialty companies that can put together job assessments so that a candidate can go and go through a series of tests to determine whether or not they can in fact perform those essential functions. Critically important. Supervisor training. Oftentimes over the years, I've learned with working with a lot of clients, when employees talk about who they work for, oftentimes the first thing that's mentioned is their direct supervisor's name, right? I don't work for Hill, I work for Prescott. I don't work for ABC Construction, I work for Joe, right? That supervisor-employee relationship is the single most important relationship in every work comp incident. If there's a friction in that supervisor-employee relationship and there's a workplace incident, more likely than not, it is not going to go well. We always say, don't allow a work comp injury to solve an HR problem. That tends to cost lots and lots of money. Talk about provider selection and agreement. And provider selection and agreement we're talking about is those doctors, right? And so oftentimes a business is, how can I control that? That's not up to me. Well, it depends on the state. Maryland and DC, it's 100% the choice of the injured worker. Virginia has some rules that put that control in place of the employer at the on the front end of that. Well, what we've experienced is when we establish a relationship with a professional medical provider that has expertise in occupational disability and disease, and we share that information with our injured workers, that we've put a program in place that in the unlikely event they're hurt, we want the best treatment for them immediately, and we want to get them back to work as soon as possible. When we communicate that properly, it's received, and we're able to, I'll use the term, soft channel injured workers to the right medical providers. We've gone so far as to have a telephonic nurse reporting and triage program. Some of our clients, most of our larger clients, when an injured worker gets hurt, the first thing they're going to do is call an 800 number. Let's take medical decision-making out of the hands of the untrained. I don't want that supervisor in the field trying to determine how serious this injury is. All I'd like that supervisor to do is pick up the phone and call an 800 number, and on the other end of that phone, have a registered nurse using expertise in occupational disability and disease and patent algorithms to triage and determine what's the next best step. We have that available. And that kind of ties into the injury reporting, the initial and the follow-up. So important to have claims reported immediately. Insurance carrier, national insurance carrier study determined that if a claim was reported 10 days from date of incident, it was 22% more costly. And if it was 30 days or longer, it was 47% more costly. So when we start to talk about the cost of workplace injuries and those hidden costs, one of the biggest areas is that delay in reporting. And perhaps one of the most important is to have that recovery at work, that return to work program. Remember that professional athlete, we get that person back to work in some kind of a modified capacity, and we're helping them heal and get back to work. And so these are just a few elements of a critical secondary prevention program that help drive the reduction of the cost and duration of workplace injuries. I'm going to shift away from the injury part of it and kind of start to move in a little bit of a different direction here, still tied to cost of insurance. We talk about benefit triangulation, right? And how would you feel if an employee out of work due to a workplace injury had a medical emergency in their family, and that claim was denied by the health insurance provider? What impact would it have on the employee or the business? So here's the scenario. You have an injured worker and they're out for 2 months. And Johnny, the 10-year-old's on his bicycle, he gets hit by a car. He goes to the hospital, he's got some significant doctor bills, and the health insurance provider denies the claim. And they deny the claim because under the health insurance contract, there's a clause that talks about actively at work. It's in most health insurance contracts. That employee is not actively at work, right? Because they're off on a work comp disability claim. And so the health insurance carrier identifies that because they go to the state unemployment tax records, or and they don't see that employee actively at work at the employer, and therefore they're not qualified under the employee benefit plan to be a covered employee. That happens, folks. It happens every single day. It happens real world. There was a time when I would tell you that wouldn't happen on small claims, but actually it happens on all of them. Everybody on this call in the last 2 years has likely gotten a letter asking if the doctor visit that they had was related to a work injury, an auto accident, some other kind of accident. Those are the insurance companies looking for somebody else to pay the claim, recover money. It's a cottage industry out there. It happens all the time now. And unfortunately, our people are suffering. So what's the fix? The fix is we have to coordinate with our work comp, our health insurance, and the federal laws, FMLA, COBRA, and Americans with Disabilities Act. This is critical. This is kind of a flow chart for you. And if you'll shoot me an email after this presentation, I'll be happy to shoot a copy of this to you. And this essentially tells you what you need to do. And here's the short of it. If you're a big enough company, if FMLA is applicable, then when an injured worker is hurt, you need to initiate FMLA. And the purpose for that is to protect their health benefits. At the end of the FMLA, if they're still out, you need to move to COBRA. If you're a company that doesn't qualify for FMLA, you need to move to COBRA immediately. The whole purpose of the benefit triangulation is to protect the health insurance of that injured worker and their family, and make sure that the premium that you're paying as the business is not going to waste. We've got a few more minutes of this, and I want to kind of dive into some direct impact on business cost. All the businesses out there have this affecting them. There's audits, your experience mod factor. Some of you have wage scale work or Service Contract Act work, and then there's multi-jurisdictional exposure. So I'm going to try to move through this at a little bit of a pace, so we'll leave some time for some questions here if there are any at the end. Let's talk about the final audit. So as you remember earlier, that left half, that premium, if you'll recall, that was $58,000. Well, every business, when we do a work comp policy, it's a projection of what we think is going to occur over the next 12 months. And at the end of that 12 months, the auditor comes out and they audit you, and then you get a final and ultimate audit. Let's talk about how that process works. First, the auditor puts all the employees in the highest rated class code. This is just the flow on how an audit's done by an auditor. What happens is the business is classified, not the individual employees. That's the rule. It's not always followed. So the business is classified based on the highest rated classification, and 100% of the employees go in there. What this does is it positions the insurance company to win in any gray area. And then at the end, if you did not identify what premium, what employee, what payroll should not have been in that highest code, that falls onto the insurance company's side of the ledger, and that increases your premium. Folks, this happens all the time, every single day in the process. I recently challenged an audit that was done to a client of ours. It took 4 appeals to finally get the audit corrected. This particular company is a large property management company. The auditor classified a group of employees in carpentry class code. That was a $14 rate versus a $3 rate for the maintenance guys that maintain the apartment complexes. It was a $31,000 additional premium. And the auditor was just wrong. And they continued to cite rule after rule after rule. And each time they cited it, we countered it. And at the end of the day, we in fact prevailed in that. Had we not have been involved, that client would have paid a $31,000 additional premium when they should not have, because of an error in the audit. And it was directly resulting to how the carrier assigned payroll to the highest remuneration code. Excluded remunerations. Did you know that there are 17 types of compensation you pay your employees that are excluded on a work comp audit? I'll highlight just a couple that tend to be common. Severance. If you pay severance to a person, you don't pay work comp premium on that. How often is that missed? How often does the auditor not even ask that question? They're just assuming that you, the business, understand what those excluded remunerations are. In our area, we have a lot of business, particularly in the government contracting industry, where employees also are in the military reserve. And we're fortunate that those businesses compensate those employees while they're also away on military duty. That particular portion of the pay is also not subject to workers' comp premium, and almost never, and I can tell you in 26 years, I've never heard an auditor ask that question. But there are a total of 17 excluded remunerations, and those are just a couple to highlight. One area, if you're a construction company or you use subcontractors in your industry, this is perhaps the single greatest area of overcharging in a work comp audit. There are very, very specific rules tied to an uninsured subcontractor. Look, if you have a certificate of insurance, when that audit happens and you're able to demonstrate that that business has work comp insurance, there's no charge for it. It's on them. But in the case when you don't, there's an awful lot of very, very specific rules. And I'll give you one, for example. If a subcontractor uses mobile equipment in the course of their work for the contractor, the most that they can be charged for premium is 1/3 of the total cost paid to that uninsured subcontractor. Think of a guy who's got a backhoe and he comes out and just digs the foundations for your company. Well, if it's him and a helper, they don't have work comp. We paid that guy $100,000 in the course of the year for the work he's performed for us. Well, at the end of the year, he didn't have work comp. It's just, Joe and the backhoe guy. Well, you only got to pay premium of $33,000. Yet when the auditor goes through the general ledger and sees 100,000 paid to that subcontractor and it's uninsured, they charge you the premium on the 100,000. That's just one example of the many examples in a work comp audit where you get overcharged. The auditor drives the process. You, the employer, aren't familiar with the dozens and dozens of pages of rules in the NCCI basic manual specific to audits. And as a result of that, you lose. You pay more at the end of the day. Quite frankly, it's the only time for the insurance company to increase their profit is at the audit. It's the only time they get to charge you extra money. And unfortunately, it happens. And it's not that they're intentionally out there trying to get money from you. It's a process that's been built that all too often relies on you, the business owner, to know all the rules. And in fact, you don't. You're trying to run a business. I'm going to shift and talk about an experience mod factor. Many of you probably are familiar with this, particularly if you're in an industry where this mod matters from a standpoint of qualifying for work, or you understand the impact that it might have on your premium. So here's a quick first thing to think about it. This is like your report card. Your experience mod factor is produced by NCCI, and it's a numerical score, and it compares you with your specific industry peers. So if you're a heating and air conditioning contractor, it's comparing to you to every other heating and air conditioning contractor in the jurisdiction for which you perform. And when you get a 1.0, and everybody knows what a 1.0 is if you've been in the industry for a while, if you think about it, that's like getting a C in school. A 1.0 means that you had the exact amount of claim activity and the dollar amount that the insurance industry expected you to have. And so I always ask the business, if your kid came home with a C in school, would you high five? Well, if you're celebrating a 1.0, you're celebrating a C. Every business has a unique minimum mod. That's the lowest mod if they had no claims. And then you could have a mod higher. And so the mod's multiplied by your premium. So in this scenario, if you're a $100,000 annual premium and your mod's 7.5, you're paying 75 grand. If you're a 1.25, you're paying 125 grand. So it does have an impact on your cost of insurance. How's it calculated? These are all the moving parts that go into determining what your experience mod is, right? The insured is you. You have payroll and you have claims. Your payroll data goes to the insurance audit department and your claims go to the claim department. And on what's referred to as your valuation date, that's your Kodak moment if you think about it. It's the date that the insurance industry takes a snapshot of that audit and your claims, and they submit it to NCCI in what's called a unit stat filing. That unit stat filing is then calculated by the NCCI, and then your mod is published. Every business, every insurance company, every claim, every audit. Think of the millions and millions and millions of data points that go into that calculation and ask yourself, how many are right? How many are perfect? Some for sure, but certainly not all. We see duplicate claims. We see errors because audits are estimated and haven't been done and the dollar amounts aren't accurate. We see typographical errors. These are common errors we see on the experience mod. But what we find more often on the experience mod is open claim reserves and elevated claims that are not closed out before the valuation date. So you have a claim, it's your valuation date, that Kodak moment is January the 1st. On December the 1st, that claim is $50,000. They paid out 10 in medical costs and lost wages, and there's additional 40,000 out on reserve. That adjuster types into their system, I'm going to follow up in 60 days. Follow up February the 1st. See what's going on with the claim. January 1st is the Kodak moment. They said to NCCI, that's a $50,000 claim. On February 1st, the adjuster takes a look at the claim again, and they realize that the employee's back to work. They didn't get an attorney. They're not suing us. The doctor bills are all paid, an additional $5,000. Let's close the claim to back to what it was, right? So we've now paid a total of $15,000 on the claim. That additional $35,000 is zeroed out. So we now have a $15,000 claim. It's beyond the valuation date. It's too late. Next year, your mod has a $50,000 claim on it, not $15,000. That is the single greatest error we see on all mod worksheets. On the bottom of every NCCI mod worksheet is this statement. NCCI makes no representations or warranties of any kind relating to the product and hereby expressly disclaims any and all express, statutory, or implied warranties, including the implied warranty of merchantability, fitness for a particular purpose, accuracy, completeness, currentness, or correctness of any information or product furnished hereunder. That is the most stunning statement I've seen in 26 years in the insurance industry. This mod worksheet has a tremendous impact on your business, and the organization that produces it basically says, don't hold me accountable for any accuracy. It could be wrong, it's not my fault. And it affects your business. It affects your businesses because oftentimes your mod is a determining factor as to whether or not you can even participate on a contract. Large general contractors, large contractors with specialty natures, oftentimes have a requirement of a certain mod in order for you to even qualify to step on their job site. I have seen businesses get thrown off of jobs, get disqualified from bidding on jobs as a result of an experience mod. How comfortable do you feel that the fate of your business is determined by an experience mod, that the organization that produces that mod basically says, don't hold me accountable for what's in it, because it could not, might be right, might not be right. Gives you a warm, fuzzy feeling. I want to talk real quick about multi-jurisdictional and we'll wrap up. Multi-jurisdictional happens in the Virginia, Maryland, DC area every day, particularly in government contracting, IT, where you pick up a new contract. This is a very technical element of your work comp, and it has to do with how the policy is actually written. There's several sections to your work comp policy. There's section 3A and 3C, and those are the two sections that deal with multi-jurisdictional exposures. If you're a contractor and you are performing work in a state on the inception date of your policy, the date your policy started, that state has to be listed in section 3A of your policy. If you go look at your work comp policy right now, you'll see it. In this particular example, we see here DC, Maryland, Virginia, excuse me, and we see the limit. And then under section 3C, there's other states' insurance, right? And in this scenario, it states all states except North Dakota, Ohio, Washington, and Wyoming, okay? This is the actual wording, and there's one section I want to point out to you. And it says, and therefore, if you have worked on the effective date of this policy in any state not listed in 3A of the information date, coverage will not be afforded for that state unless you notify us within 30 days. I have seen claims denied because of a business that was actively working in a state on the start date of their policy that was not listed in section 3A. This happens. We had a $400,000 claim. There was an error by the company, by the insurance carrier, but they fought us for 6 months until we were finally able to demonstrate to them that in fact that company was not working in the state on the inception date. They based their decision on an Indeed ad for employment in the state that was being added to the policy. That was back in August on the inception date of the policy. The GovCon contract didn't start till December, and the person was hurt 2 weeks after the contract. It was an IT company, and the employee was hurt lifting a box of paper. The claim was $400,000. And it was all tied to section 3A, 3C. So if you're a business, and so many businesses in the Maryland, Virginia, DC area have this scenario, this is a critical element. We're coming up on 11:55. We've got about 5 minutes left for people's time. I'm going to skip through the Davis-Bacon McNamara O'Hare Act. If anybody has any questions about wage scale work, feel free to contact me. Here's my contact information. Dean at Hill Group, my cell number, my office number. If any of this resonated with you and there's opportunities for us to have future dialogue, we certainly have assessment capabilities where we can dive into your work comp, through your audit, through an experience mod, or very, very robust in-depth assessments and plan development for secondary prevention strategies. Thank you very much for your time. I know we kind of covered a lot. It was fast-paced, but feel free to reach out to me with any further questions. Dario?
Yeah, thank you, Dean. Really a comprehensive overview of the complexities of work comp, which probably most people don't think of. So really showcased the depth of knowledge that you have on the topic. I appreciate you taking some time to do that today, Dean. We did get a few questions. I just wanted to field them, and certainly I encourage people to ask questions if they'd like. But one came up was what happens, or can you find out if an employee has had prior work comp injuries, and could that prevent you, or could you choose not to hire that employee because of that history?
So as you recall, we talked about that hiring process, and there's three phases of that hiring process: the pre-offer, the post-offer, pre-placement, and then actual employment. We have to be very careful what we can ask in the pre-offer, but once we've given a conditional offer of employment for that person, one of the things we recommend is get a physical of that person.
Okay.
We can also do a work comp background check, right? Which is a state record. And most of our clients do that. You can use that to help you determine whether that person is capable of performing the essential functions of the job. And then you can simply withdraw that job offer. We would always encourage you to consult with your employment practices attorney in some of these decisions. And we have some folks that can help you with that.
Oh, interesting. Yeah, I never thought of it that way. And then one that's probably pertinent in where we are now. If an employee has COVID, is that considered a work comp claim? Could that be viewed as work comp? Is there any insurance that could cover that employee?
So actually, a great question. And it depends on the type of business you're in. And what we're seeing states do is enact executive orders, legislative fixes for this, and it's really tied specifically to an employment class that has a direct connection to the exposure. So we're seeing first responders, healthcare industry, whether they're hospitals or nursing homes, those types of business classes. We certainly see it because it does in fact have the potential to occur in the normal course and scope of work. So what we're seeing legislatures do is pass a presumption rule. And if that person that's working in the nursing home gets COVID, it's presumed to have occurred in employment. The restaurant worker, not. The construction worker, not in the normal course and scope of their work. So they're not going to get qualified for that, most likely.
Interesting. And then, the other issue, especially from the EB side or employee benefit side of a business and human resources, is HIPAA. And, with HIPAA, do we really have access as employers to finding out about people's, work comp history? I think you mentioned it, that there's some public record, but comment on that real quick.
Yes, actually HIPAA doesn't apply in workers' comp, right? You got to bring employees back. We have to understand from the medical provider what the employee's condition is so that we can bring them back with certain job restrictions so that we don't exceed those. So from a standpoint of workers' comp, we put HIPAA out the door. Now, we can't disclose that to the outside world, right? We're not going to go out and say, hey, so-and-so's got this. But in terms of managing that injury and working with that employee, those medical providers are free to disclose to us what's going on so that we can, in fact, work to manage it.
Thank you, Dean. And I'll open it up. Anybody have any questions for Dean before we wrap up? I've got us at 11:57, so we still have a minute or two. Feel free to ask a question. Dean, would it be okay if we distribute this presentation to attendees?
Absolutely.
Okay. And I think you mentioned it already. If somebody wanted to follow up and have a sidebar conversation, your contact information is here. They can reach out to you directly, or we're certainly happy to facilitate this. Again, I want to thank you, Dean, for really giving us an in-depth overview of work comp and the complexities associated with it. For the people on the call, we will be distributing a copy of the presentation along with a recording of the presentation. Now, I will mention that we've Molly Jackson on my team, she's great. She facilitates all these webinars. I thank her so much for managing the invitations and the event. But more importantly, we've also created a YouTube channel. So you'll be getting a link to our YouTube channel with all the presentations that we have, including this one today. So again, thank you, everybody. Have a wonderful weekend. And please stay tuned for our December 18th event. So thank you very much. That'll end our session today. Thanks, Dean.
Thank you, everyone.
Everybody.
Thank you.